Welcome back. Acupuncture was once considered on the fringe of medical options for traditional problems, but over the past few years it has certainly gained widespread acceptance. And joining us to talk about that today, acupuncture and how your children may benefit, Dr. Lynn Rusy with the Children's Hospital of Wisconsin. Doc, thanks for being here.
You're welcome.
Let's go through, and for people who might not understand, tell us exactly what acupuncture, I almost called it acupuncture is.
There is acupressure.
Right, that's different.
I use both. Acupuncture is an ancient medicine that's been around for millions of years in China and the Far East. But there's two basic theories about why they think acupuncture works. The Chinese theory is that the body has all of these pathways where energy is flowing, and we're healthy when energy is there and flowing successfully. And when you have a pain problem or a medical problem, the energy gets plugged up. Energy is called qi, Chinese language. And so the acupuncture needles are placed at different ends of those pathways, the meridians, and it opens up the flow of the energy and improves health. There's scientific evidence that acupuncture works. It's been shown that significant endorphin levels are increased under acupuncture treatments. Functional MRI scans show that certain areas of the brain are more activated with just one or two needles in the body.
So given all that, I mean, if it's working on adults, why wouldn't it work on children? What sort of things do you use it to treat in children? In children,
I work in the pain clinic at Children's Hospital, and the majority of patients that I treat will have problems like chronic headaches, fibromyalgia, chronic nausea. With some of the cancer patients that are sick to their stomach from some of the chemotherapy, acupuncture works great for that.
And you're seeing good results with this?
Excellent.
Obviously, you wouldn't continue doing it, right?
Right.
All right, now you told me it doesn't hurt.
It doesn't.
Did you brought the thing?
I brought a needle to put in you.
Because I'm terrified of needles to begin with.
They're very small. They're solid needles, so it's not a hollow bore needle like a IV needle.
If you just pop me one time, though, it's not going to fix my chi, right?
No.
All right.
There.
Barely felt it. Now it just sits in there?
So it would stay in there for maybe a period of treatment is about 25 to 40 minutes. You pull it out, it doesn't even bleed. It's sterile, so they're not contaminated needles. There's no risk of infection having an acupuncture treatment. We should have covered that before
that, but no.
Right, right.
Well, all right, I didn't feel a thing, hardly, so again, I really appreciate you being here and talking a little bit more about that. And for more on acupuncture or the services offered at Children's Hospital of Wisconsin, we did put a link up on our website, tmj4.com. And let's take a quick look at tonight's primetime lineup. 6:30, we have Wisconsin.